Hello everyone, and thank you so much for being here today on this Medicare 101 presentation hosted by me, Selena Onowe, your local Medicare agent with South Coast Medicare. And you guessed it, we're here to talk about Medicare. In this presentation, we will be going over exactly what Medicare is, what it covers, what it doesn't cover, different coverage options with Medicare, as well as how we avoid any kind of penalty that's associated with Medicare. You want to stay till the end of the video. We do have 2 bonuses. So make sure you stay till the end, as well as getting a personalized Medicare assessment through me or one of my colleagues here at South Coast Medicare. So without further ado, let's get started. When we are talking about original Medicare, we are speaking about Medicare Part A and Medicare Part B. Medicare Part A is going to cover hospital expenses. There is a monthly premium of $0 as long as you've worked 10 years full-time or 40 quarters. There is a deductible of $1,484 per benefit period. What is a benefit period? Great question. Benefit period is going to be from the day you enter the hospital to the day you're discharged, and then 60 days after that. So it can happen up to 5 times a year. Once that deductible is met, Medicare will cover 80% of the charges and you will be liable for the 20. Now there is no maximum on that limit. Part B over here is on the right-hand side. That is going to cover doctor expenses or anything that's outside of the hospital. There is a monthly premium associated with it. It is about $148.50 depending on your income level. That is going to vary, of course. So if you have any further questions about that, please reach out to me. The deductible is $203 every calendar year. So unlike the Part A, this is going to be an annual deductible. Of course, you will still be in charge of 20% of all service charges on top of that. And again, there is no limit. Part B excess charge, you are going to be responsible and liable for that 15%. If you are currently receiving Social Security benefits, you will automatically be enrolled into Medicare. You will receive an ID card within the first 3 months before your birthday. And of course, that $148.50 will be taken out of your Social Security check, and that's going to be monthly. If you do not receive any kind of benefits through Social Security, you will need to enroll into Medicare. Medicare is available to you for enrollment through the www.ssa.gov/benefits/Medicare. So that is going to be where you can sign up online. Over the phone is going to be 1-800-772-1213. You could walk in person. A lot of the offices are still currently closed, so I would call ahead of time to make sure. Or of course, you can mail in an application to the Social Security office. Remember that Part B is going to be billed to you because you will not be receiving Social Security checks, so they can't deduct it from anything. So they do bill for the first 3 months, so they do it quarterly. Original Medicare enrollment, your coverage begins the first of the month of your birthday. Unless you are born the first of the month, then your coverage would start the first of the prior month of your birthday. Original Medicare, if you are still working and covered on your employer plan, you can enroll effective of your 65th birthday month, or you can delay that Medicare Part B until you retire. It is very important that you do check in with me or one of my colleagues to make sure that you're getting the best coverage possible. A lot of the times we are able to take people off of their employer coverage, even though their employers are contributing to it. The Medicare plans available are much greater in benefits. So that's something that we can definitely do assessment over. Now let's talk about what Medicare coverages are available to you. So there are two. It's going to be called the Medicare Supplement versus the Medicare Advantage. So there's two different types of coverages we can get. So here is a handy dandy chart on the screen. On the left hand side, you're going to see that we stay on original Medicare, meaning Medicare Part A hospital insurance and Part B medical insurance. However, we did talk about a $1,400 deductible every benefit period, as well as 20% that we're liable for. That is why we get a Medicare Supplement plan, or also known as a Medigap plan. On top of that, you will need to add a prescription drug coverage. So whether you take prescriptions or not, you do need to add that prescription drug coverage to avoid any kind of penalty. On the right-hand side, we're going to talk about the Medicare Advantage Plan. So we were talking about two different ways of getting our Medicare coverage, and option number 2 is going to be also called Part C. It actually combines your Part A, your Part B, and the Part D into one combined plan. That is going to include everything that original Medicare covers and more. Comparing the two options. So again, when we talk about the supplement plan, if you saw, we needed to get everything individualized. So there's going to be a supplement plan. You're going to need to get a drug plan, as well as any extra benefits such as dental, vision, hearing. So all of that is going to be placed on a supplement plan. The pro is that you are able to go to any doctor as long as they accept Medicare. So it's going to be a straight yes or no, not do you accept my insurance coverage. It's going to be, do you accept Medicare? If the answer is yes, your benefits are going to be covered as long as they're covered under Medicare. There is a premium. So on top of the $148.50, you will have to pay an additional premium, as well as an additional premium for the Part D as well. So remember, with the Part D, it is going to depend on the prescriptions you take. So that is going to be something that we have to factor in. Medicare Advantage, on the other hand, has the full coverage of original Medicare. So as mentioned, it covers Part A, B, and D, as well as a lot of these plans cover dental, vision, hearing, and some extra benefits. That is all going to be a part of the Medicare Advantage plan. So it is also called Part C, also known as a managed care plan, meaning that you will see all your doctors within a specific medical group. Now, the pro to that is going to be that all of your doctors are going to be in constant contact with each other, and your primary care physician is going to be like your manager, your care manager. So he's going to make sure that he stays in contact with all of your specialists, whether he has a hand in it or not. So he's going to refer you to the specialist, he's going to check up on you with the specialist, and he's going to make sure that all of the treatments that are established for you are going to be, they're going to work well together. There is quite a few networks available, and of course that Part D is included. Talking about Medicare Supplement plan. So as mentioned, we stay on original Medicare, we get that supplement plan and add on that prescription drug plan. So once again, Medicare is going to be very defined upon what your needs are. So depending on your needs, you may need full coverage for your supplement, you may need less coverage. So we will have to talk about that with you personally. Prescription, same thing. There are many prescription drug plan options available. However, you're going to choose the one that matches your formulary. So each of the prescription drug plans have different formularies, and depending on the prescriptions you take, is going to depend on the one that you get. So Medicare Supplement plan options are important. Medicare Advantage. So of course, everything that you get on original Medicare is going to be combined into your Medicare Advantage plan, including that prescription drug plan. So you're going to get that hospital expenses and doctor expenses paid for through your Medicare Advantage plan, also known as Part C. There are a lot of plans available near you at a $0 premium. So of course you have to still pay for that Part B premium, but on addition to that, it is there are $0 options available. Medicare Advantage, you do need to stay within a medical group, but of course there are pros and cons to that. Talking about Medicare Supplement plans, each letter is going to cover different benefits. So there are quite a few plans available. Again, it's really going to be based upon your needs. The best time to enroll into Medicare is going to be 6 months prior to your birthday month. So you're going to get the best rates, avoid any kind of mistakes, and of course, just get it off your checklist. Standardized supplement plans are federally regulated. So that means that no matter which carrier you decide to go with, as long as you have that letter, it's going to cover the same thing across the board. So when it comes to supplement plans, they are standardized. So not every plan is going to have different nuances. They're all going to be the same based upon the letter. Here is a list of different companies that I personally work with. As you can see, I have United Healthcare, Blue Shield, Anthem, Humana, Scan. There's so many. So whichever one you decide or is best for you is the one that we go. So as mentioned, I am a Medicare agent, meaning I don't work for any one company. So I do what's best for you. So, Medicare is, as I mentioned, dependent upon your needs. So let's go ahead and do an assessment for you and figure out which needs are going to be met by which carrier. 3 truths of using a broker. Number 1, it's actually free of charge. The prices that you pay are going to be the same whether you go through a broker or not. And of course, we're not biased because it doesn't matter to us which plan that you choose. You're also able to speak to me directly. So you will have a personalized agent to work with. So instead of having to call into a huge insurance carrier's 1-800 number and having to verify your information and press 1 and press 12 and 8, and you don't have to do that. You can just call me direct or call one of my associates and we take care of you. So that's one of the added benefits of going through someone such as we're also local. So we know what's going to be best in your area. Which Medicare Advantage is best? It's really going to depend on your zip code and county. As mentioned, there are a lot of $0 monthly premiums available with the Medicare Advantage plans. It's really going to depend on which doctors you see, what's important to you. Some people find that they need to make sure that their doctors are all in the network, which is very important to one person. Another person could, really want all the extra benefits that come with Medicare Advantage. So we really need to do an assessment on exactly what's important to you and what needs are needed to be met through Medicare for you personally. Part D, adding Part D prescription drug coverage. There is going to be a deductible stage depending on which Part D you end up going with. Some of them have deductibles, some of them don't. Initial stage is going to be when you've either met your deductible or, as mentioned, some of them aren't going to have a deductible at all. So if you're on the Medicare Advantage plan, you're not going to see a deductible. So you will pay a copayment for each drug that you're taking when you pick it up from the pharmacy until the total retail cost of those drugs exceed $4,130. Then you will enter the gap coverage, where you pay 20% of all prescription drug costs until you reach $6,550 out of your pocket for the year. Then you are going to be bumped into the catastrophic coverage stage. In this final stage, you will pay about 5% of the drug costs for the rest of the calendar year. Again, some people may never even leave the initial stage coverage, so it's really dependent upon which prescriptions you take. And if you would like a breakdown for you personally, again, reach out to us and we'll make sure to get that over to you. Input drug list into the Medicare's online calculator. So how do you figure out which Part D you're going to need? So we need to know exactly which medications you take, which pharmacy you go to. We get to compare all the plans that are available in your zip code, enroll you into your plan of choice, and reevaluate you every year. So that's one of the added benefits of working with us, is that we don't just meet you one time and leave you stranded. Every year there's new plans coming out, new formularies, and there is an annual election period every year from October 15th through December 7th, and we always reach out. Part D late enrollment penalty. So there is a late enrollment penalty if you don't enroll into a Part D prescription drug plan. A lot of the times, maybe we don't think we need it. It doesn't matter, because they penalize you that 1% for every month you could have had coverage but elected not to enroll. So you do have a 63 grace period, so you do want to make sure that you don't get that 1% penalty. It is compounded. So just to recap on everything we went over: original Medicare, Part A, as long as you've worked full-time for 10 years, that's $0. The premium on the Part B, which is for doctor expenses, is about $148.50, depending on your income level. If you do decide to stay on original Medicare, you will need to get a Medicare Supplement plan. Plan G is the most popular supplement plan. Again, it really varies depending on your zip code and what your needs are. And then, of course, prescription drug plan. So that monthly premium is roughly around $30, again, depending on what your needs are. All right, so right now we are in phase 1, Medicare Education. So hopefully after this video, you have a better understanding for Medicare, what it covers, what it doesn't cover, and which extra benefits we need. Phase number 2 is we need to schedule your free consultation to discuss your specific situations. And of course, you get to receive those bonuses that we talked about. So the first bonus is your personalized Medicare roadmap. So step-by-step action guide, exactly what Medicare is, exactly what you need to do in order to get coverage. And bonus number 2 is my Medicare cost summary. So we will do a full outline on exactly what your costs are going to be every year or every month for the year. So that way we help you on that fixed income, make sure that you get everything covered and that it's fiscally feasible. Phase number 3 is $0 for lifetime billing and claim services for our clients' service team. We provide you with able to check your cards. We reach out to you. Of course, it's $0 for your annual review. We don't leave you. So if you sign up with us today, it's not like you're never going to hear from us again. You have any questions, you just call us direct and we answer that. So you get like an extra concierge, right? Kind of like a travel guide. It's nice. All right, so make sure that you schedule your free consultation with me or one of the colleagues here. Make sure that you get your bonuses. Of course, we've got 2 bonuses as I mentioned. So click on that golden telephone now to schedule your personalized Medicare assessment. And it was such a pleasure speaking with you guys today on this Medicare 101 presentation. Once again, my name is Selena Onoe with South Coast Medicare, and I thank you once again and have a wonderful day. Bye.